NCLEX practice questions and answers, why you're getting these wrong. Question 1. A 65-year-old man has been admitted to the hospital for spinal stenosis surgery. When should the discharge training and planning begin for this patient? Option A. Following surgery. Option B. Upon admission. Option C. Within 48 hours of discharge. Option D. Preoperative discussion. The correct answer is option B. Upon admission. Discharge planning must begin immediately upon admission to ensure all post-care needs, rehabilitation, and home equipment are secured in advance. Question 2. A nurse has just started her rounds delivering medication. A new patient on her rounds is a 4-year-old boy who is nonverbal. This child does not have on any identification. What should the nurse do? Option A. Contact the provider. Option B. Ask the child to write their name on paper. Option C. Ask a coworker about the identification of the child. Option D. Ask the father who is in the room the child's name. The correct answer is option D. Ask the father who is in the room the child's name. If a pediatric patient cannot state their own name, a parent or legal guardian present at the bedside serves as a reliable secondary identifier. Question 3. A nurse is administering a shot of vitamin K to a 30-day-old infant. Which of the following target areas is the most appropriate? Option A. Gluteus maximus. Option B. Gluteus minimus. Option C. Vastus lateralis. Option D. Vastus medialis. The correct answer is option C. Vastus lateralis. The vastus lateralis is the largest, most developed muscle in infants and is the safest site for intramuscular injections to avoid nerve damage. Question 4. A parent calls the pediatric clinic and is frantic about the bottle of cleaning fluid her child drank 20 minutes ago. Which of the following is the most important instruction the nurse can give the parent? Option A. Monitor the child closely at home. Option B. Take the child immediately to the emergency room. Option C. Contact the poison control center quickly. Option D. Give the child syrup of ipecac. The correct answer is option C. Contact the poison control center quickly. The poison control center has precise, chemical-specific neutralization and management protocols. Inducing vomiting with ipecac is strictly contraindicated for corrosive cleaners. Question 5. A mother is inquiring about her child's ability to potty train. Which of the following factors is the most important aspect of toilet training? Option A. The age of the child. Option B. The child's ability to understand instruction. Option C. The overall mental and physical abilities of the child. Option D. Frequent attempts with positive reinforcement. The correct answer is option C. The overall mental and physical abilities of the child. Toilet training readiness is not dictated strictly by age, but rather by the physiological sphincter control and cognitive ability to recognize the urge. Question 6. A 28-year-old male has been found wandering around in a confused pattern. The male is sweaty and pale. Which of the following tests is most likely to be performed? Option A. Blood sugar check. Option B. Computed tomography scan. Option C. Blood cultures. Option D. Arterial blood gases. The correct answer is option A. Blood sugar check. Confusion, diaphoresis, and pallor are classic, hallmark signs of severe hypoglycemia, making a rapid blood glucose check the top priority. Question 7. A 20-year-old female attending college is found unconscious in her dorm room. She has a fever and a noticeable rash. She has just been admitted to the hospital. Which test is performed first? Option A. Blood sugar check. Option B. Computed tomography scan. Option C. Blood cultures. Option D. Arterial blood gases. The correct answer is option C. Blood cultures. A fever, rash, and altered consciousness in a young adult living in close quarters highly suggests meningococcal meningitis. Blood cultures must be drawn before starting antibiotics. Question 8. An 84-year-old male has been losing mobility and gaining weight over the last 2 months. The patient also has the heater running in his house 24 hours a day, even on warm days. Which test is most likely performed? Option A. A full blood count. Option B. The electrocardiogram. Option C. Thyroid function tests. Option D. Computed tomography scan. The correct answer is option C. Thyroid function tests. Unexplained weight gain, profound lethargy, and cold intolerance are defining symptoms of hypothyroidism, requiring thyroid function testing. Question 9. A fragile 87-year-old female has recently been admitted to the hospital with increased confusion and falls over the last 2 weeks. She is also noted to have a mild left hemiparesis. Which test is most likely performed? Option A. Full blood count. Option B. The electrocardiogram. Option C. Thyroid function test. Option D. Computed tomography scan. The correct answer is option D. Computed tomography scan. Frequent falls in the elderly can cause slow bleeding subdural hematomas. Confusion and unilateral weakness, hemiparesis, require an immediate CT scan of the head. Question 10. A nurse is reviewing a patient's chart and notices that the patient suffers from Lyme disease. Which of the following microorganisms is related to this condition? Option A. Borrelia burgdorferi. Option B. Streptococcus pyogenes. Option C. Bacillus anthracis. Option D. Enterococcus faecalis. The correct answer is option A. Borrelia burgdorferi. Lyme disease is caused by the spirochete bacterium Borrelia burgdorferi, which is transmitted to humans through the bite of infected black-legged ticks. Question 11. A nurse is reviewing a patient's chart and notices that the patient suffers from conjunctivitis. Which of the following microorganisms is related to this condition? Option A. Yersinia pestis. Option B. Helicobacter pylori. Option C. Vibrio cholerae. Option D. Haemophilus aegyptius. The correct answer is option D. Haemophilus aegyptius. Haemophilus aegyptius is a common bacterial cause of highly contagious acute epidemic purulent conjunctivitis, commonly known as pink eye. Question 12. A patient admitted to the hospital with myocardial infarction develops severe pulmonary edema. Which of the following symptoms should the nurse expect the patient to exhibit? Option A. Slow deep respirations. Option B. Stridor. Option C. Bradycardia. Option D. Air hunger. The correct answer is option D. Air hunger. Fluid filling the alveoli prevents oxygen exchange, leading to profound hypoxia, extreme shortness of breath, and a desperate sensation of air hunger. Question 13. The nurse is conducting nutrition counseling for a patient with cholecystitis. Which of the following information is important to communicate? Option A. The patient must maintain a low-calorie diet. Option B. The patient must maintain a high-protein and low-carbohydrate diet. Option C. The patient should limit sweets and sugary drinks. Option D. The patient should limit fatty foods. The correct answer is option D. The patient should limit fatty foods. The gallbladder releases bile to digest fats. Limiting dietary fat prevents gallbladder contraction, thereby preventing severe biliary colic pain. Question 14. A physician has diagnosed acute gastritis in a clinic patient. Which of the following medications would be contraindicated for this patient? Option A. Naproxen sodium. Option B. Calcium carbonate. Option C. Clarithromycin. Option D. Furosemide. The correct answer is option A. Naproxen sodium. Naproxen is a non-steroidal anti-inflammatory drug that severely irritates the gastric mucosa and increases the risk of dangerous gastrointestinal bleeding.